We know a few things about young athletes. They love to play their sports. Their parents encourage them and love to watch them play. But undeniably, there will be knee injuries, specifically to the ACL. And when there are, you need to seek the counsel of these folks, the experts who can give us so much insight on ACL injuries. Dr. Charlie Popkin, Dr. Lauren Redler, Dr. Christopher Ahmad. And I'm Kim Jones, and I'm so happy to be here with you to talk about an injury that seems like it has become so common. What is the ACL, Dr. Popkin, and why is it so prone to injury?
So the ACL is one of 4 ligaments in the knee, and the knee is a little bit different than some of the other joints in your body. It's a hinge joint, it's not a ball and socket, and usually it rotates just like a hinge. And the ACL is one of 4 ligaments that connects the thigh bone to the shin bone, and one of its main factors is that it helps decrease anterior translation, or the shin bone moving forward on the femur, and also rotationally. And sometimes when our athletes plant and pivot, it's just more than that joint can handle, and the ACL pops.
When you injure your knee, often you injure other tissues, and in the knee there's cartilage and there's a meniscus. And if you injure those tissues, they don't heal well. And as surgeons, we can correct an ACL, we can surgically reconstruct it. But the cartilage and meniscus damage that can also occur, much harder to fix, much harder to get healed. And if those tissues don't heal well, it resembles arthritis at a very young age.
Dr. Redler, if I'm a parent, if I'm an athlete, I would want to know this. Are there steps I could take to avoid this injury?
Absolutely. Proper conditioning is vitally important. There are many great injury prevention programs out there, and they differ with the specific exercises or agility drills that they have the athletes do, but they have a couple of common focuses: increasing flexibility, increasing strength, increasing the athlete's agility, and their ability to safely jump and land.
The studies show that the programs we just discussed can reduce ACL injury risk by 50 upwards of 80%. And the reason is it enhances neuromuscular control of your body. Our challenge right now is to get these young athletes to do these programs. If they do the programs, they will work.
So let's talk about warning signs that parents, coaches, and the athletes themselves can be on the lookout for. Let's go by sport. And Dr. Ahmad, how about the sport of soccer?
The first advice I give to parents and even the players themselves is to interview your coach and find out if your coach has a real sincere interest in injury prevention. The second part that parents should be aware of is fatigue. Some of these kids are playing on multiple teams, multiple games, tournaments. As fatigue levels rise, so does the injury risk.
Same question, Dr. Popkin. How about hockey and football?
Football's a little bit different. While still the majority of those injuries are non-contact, a lot of them are collision. It's a collision sport, and you can have additional injuries to your knee, like Dr. Ahmad had mentioned before, to your cartilage, sometimes the meniscus, and sometimes those collision injuries can be so bad that you can have a multi-ligament knee injury, which can be quite severe. I think the biggest tip for parents out there is fatigue, sometimes in the fourth quarter. That's when a lot of these can happen more along the non-contact lines. And then with regards to sports like hockey and skiing, those are more gliding sports. So again, that's going to happen in the third period or with your last run on the slope.
Dr. Redler, when you talk about field sports and female susceptibility to the ACL injury, what can you tell us?
Absolutely, Kim. Females, we know from a huge body of research, are at an increased risk compared to their male counterparts to injure their ACL. We actually recently validated a screening test that can help all young athletes identify at-risk behaviors that can hopefully prevent them from becoming another player on their team with an ACL injury. By having the coaches and athletic trainers, the people that are working with these athletes day in and day out and see them every day, observe them jumping off of a box and their landing mechanics, they can help identify the at-risk behaviors like hips being too extended, their knees being too extended, landing with their knees too close together and not landing light like a feather. And by identifying these at-risk features, we can hopefully prevent some ACL injuries.
Our biggest area of intense research right now is to stop the injury from happening, not react to an injury by correcting the problem of the tear.
Now, when it comes time to parents and the athletes and needing treatment options, Dr. Ahmad, what do you tell them about recovery expectations?
The surgery itself, we have that trick down. We can fix the ACL when it's torn, but that's only half of the process. The other half is the rehabilitation. After surgery, which only takes about 60 minutes, athletes and these patients will have to undergo intense physical therapy several times a week It competes with their ability to go to school, socializing, things like that. So it's a real heavy burden afterwards. It takes about 6 months for them to be strong and have the ACL healed well enough for them to start to integrate back into their sport.
Dr. Redler, when an injury is sustained, I would think that for the parents and the athlete, it is of critical importance to get the correct diagnosis and understand treatment options, right?
Absolutely. The correct diagnosis and looking, like Dr. Ahmad mentioned earlier, about the other injuries that can happen with an ACL tear are absolutely important, and that they not be missed and that they're also treated. But even more so, looking at a broader picture at the athlete as a whole, and that this sport is their identity and this injury is taking them out of that world. There's also a psychosocial component that definitely needs to be addressed to have a successful outcome.
Well, Dr. Charlie Popkin, Dr. Lauren Redler, Dr. Christopher Ahmad, thank you so much for educating us about an injury that is so common, but we learned a lot today, including it can be prevented, and there's obviously hope if you do indeed require ACL surgery. Thanks so much for joining us. We'll see you next time.